I'd like to invite Maureen Collins from Boston Scientific to talk about the cholangiocarcinoma, CCA Patient Assist mobile app.
Good afternoon. My name is Maureen Collins, and I'm with Boston Scientific's Endoscopy Division. I'm with the Communications Organization. First, I'd like to thank the Cholangiocarcinoma Foundation for inviting us to participate this week. It's an opportunity for us to talk with you about this app that we, in collaboration with the foundation, have developed. I'm aware that a couple of my colleagues were here last year, and I believe that they probably spoke as part of the podium session, but they had a lot of one-on-one conversations with patients and caregivers to get input to the app, and I know at that time it really helped shape the project. People know Boston Scientific, of course, for medical devices, but over the last several years, we've been developing a variety of services and solutions. One category we refer to as really health initiatives and programs. They are things like we work with health organizations and we fund colonoscopies for underserved patients. We fund and help support patient education and community outreach, research, and things like that. Our Close the Gap Health Equity for Life program is a program that allows us to work with the foundation and the important work that they do. For those of you who spend time on the foundation's website, you've probably seen there's a biliary emergency information card. You can go online, it's a form. You can fill out information about yourself, typical emergency contact information, some information about your medical treatment. It's very nice. You print it out, you fold it up, you put it in your wallet or your purse. Well, for all the obvious reasons, that's kind of difficult to manage. If information gets updated, you have to go back online, you fill out the form, papers get torn, they get lost. So the Patient Assist app is really a smartphone version of the medical information card, except it's a lot easier to enter the information, manage it, and to share the information. So let me take you just a few of the key highlights of the app. You'll see here I've highlighted in red the patient data section, because here you can enter information about your treatments, stent implants, and medications. And in particular, I like the medication area because there's a camera built in. And rather than having to actually enter all the data, you can simply take a picture of the label. Simple but really nice solution. This is where that you would enter all of your contact information for your caregivers. And that could be family and friends. That could be physicians and nurses that you're working with. And the foundation has a feed into the app as well with the latest news and research. So it's a great connection back to their website. And this is the area that, like many apps today, this is something that you go in and you enter the data. And for patients who aren't necessarily smartphone savvy, maybe they have a family or a friend who can help them with that and can also help them maintain the information themselves, because you can self-select as a patient or you can self-select as a caregiver. Couple of other sample screenshots. On the left-hand side here, you'll see that there's a section called For the Doctor. You may be seeing clinicians that have not necessarily involved with treating your current condition, and they really don't know very much about, or if anything, bile duct cancer. So this is a very simple explanation of what it is, and at the same time, you can share with them the information that you've entered about yourself, about your treatments and your medications, and then, of course, your contact information as well. On the right-hand side, there's in an emergency section, and there's two areas here, and one is for the patient, and that is if you are experiencing symptoms, you can refer to this. It will explain the symptoms for ascending cholangitis and, of course, direct you to seek medical treatment right away. Now, if you do that and you end up in an emergency room, again, perhaps with a care team who is completely unfamiliar with bile duct cancer, there is a section here that explains what it is, explains the symptoms to them, and also has a link to treatment guidance for that physician. And again, all of your information is there, contact information, past medical treatment, and then the medication that you are on. So it is a new smartphone app, a new emergency information card. It is free. It is in development right now. We've been doing some user testing over the last couple of months, and we've gotten some great feedback on that. So we're in the bug fixes and improvements phase. It will be available on Apple phones and Android phones as well. So I'm sure once we get that launched, the foundation will be anxious to get the word out so that everyone knows about that. So I will be around today. I will also be around tomorrow. Please feel free to stop by, find me. I'll be at the table. I appreciate your time. Thank you.